Well, I think it's going to be a great place to work in for staff. It's going to be a great nurturing environment for patients and their loved ones to know that they're going to be well looked after. And I think it's going to be a service that the community is going to be very, very proud of.
The planning's at the point where in a lot of the wards and departments I can just about close my eyes and walk through them because we've been so intimately involved in the planning.
The current facilities are fine for what they were designed for, but they're not fine for a modern healthcare service. We think that the design that we've come up with and the facilities that will be in it will be a very, very substantial improvement.
We're creating a brand new facility for the community. It's going to have 134 new inpatient beds with 18 to follow. And there's a whole lot of activities which some of them are at the current Bega hospital, a lot of them aren't or in surrounding areas, so a real opportunity to consolidate those functions within a brand new hospital.
We get patients from Eurobodella or from Cooma, from the other side of the Victorian border who come for orthopaedic services. And so having enhanced operating theatres and surgical ward and then rehabilitation will make it just such a fabulous place for treatment.
The outcome has really been a result of thinking about how the hospital will work now and how it will need to work in the future and testing that with all the stakeholders.
It's exciting to be involved in a facility that's going to draw primary and community and acute and subacute and ambulatory into this one precinct.
Something you take away from having visited the site, that image of the hills rolling out in front of you, the river, and then looking up to the mountains beyond. And it's something we wanted to emphasise in the development of the building.
The inpatient and patient areas have beautiful views. We're orientating people to place and to time, but we're also tying people back to the land and to the community. The design is going to deliver a healing, relaxing environment.
When it opens in 2015-16, there will be spare capacity. It's been built for 2021, so really a 5-year growth even after it opens.
It really will be that fabulous health precinct which supports not only the patient but supports the staff, carers and relatives.
You know, the hospital no longer should be the place on the hill that you go just in desperation. It should be a welcoming, community facility, and we think we've achieved that with this design.